Thank you very much, Mr. Chairman. First, let me applaud the gentleman for the legislation. I think all of us recognize that, and California has a lot of the industry that develops a lot of these innovative devices, and so I think we all want to make sure that these industries have an opportunity to move forward. And I think just about every member on this committee would say, let's go forward and let's undo the tax if, as some of my colleagues on this side have said, we come up with a pay-for to make up for that revenue, because you don't come up with the revenue, and what you're telling a lot of Americans is that we're going to have to cut back on what they can expect to have in their health insurance plans through the Affordable Care Act. Or you're going to tell another industry, guess what? We're going to have to decrease your reimbursement, whether it's a doctor like Dr. Bustani, or whether it's a hospital like any hospital in our district. We're going to have to tell those providers, we're going to have to cut back on how much we reimburse you through this program, because we have $24.5 billion less to provide those services. And so it's not that there's an industry that deserved to have a tax imposed on it, that was a bad actor, and therefore we wanted to punish. No, these medical device companies do phenomenal things for Americans who today are alive as a result of all that innovation. And again, as someone who comes from the state of California, probably the most innovative state in the nation, we want to continue that. But here's the problem. As who was it that said it? I don't know if it was Mr. Pasquarello or somebody said it earlier. You got to face the fact that these things cost money. If you're going to provide services, it's not free. Money doesn't grow on trees. And any American knows that. You got to pay for the services for your kids, for your parents, when they get health services. So I think what we're saying here is, compare to what? So the medical device tax, which the medical device industry understood when we passed the Affordable Care Act was going to go into place, and they understood because they'd get a lot of new business as a result of all those new millions of Americans who would get insurance coverage and now could use those medical devices, that they understood they were going to give at the office. So here's some numbers. This bill, the tax itself for the next 10 years will collect about $24.5 billion from the medical device industry. So it's about $2.5 billion a year that's collected in taxes from the medical device industry. In the first year that the medical device tax was collected, the industry grew its profits by $8 billion. So as a result of the Affordable Care Act, this industry is doing much more business to the point where it raised $8 billion more in profits than it had the previous year. And so, is it painful? Yeah, it can be painful. But is it paying for itself by having new service and new clients and new patients who use the medical devices? Absolutely, that's proven itself. But the more important point is, if you're going to give it back to Peter, what are you doing to Paul? And here we have to be honest with ourselves. We got to pay for things. You can't just continue to say, I want to do you a favor, I'm going to be good to you, and we're not going to pay for it unless we want to continue borrowing from China to pay for all these things. At some point, you got to pay. And that's what we did. We made sure that this new Affordable Care program that gave millions of Americans, for the first time, access to good insurance coverage, or for those who had lost it, access again to good insurance coverage, was covered. So it wouldn't be done on the credit card of the federal government, or it wouldn't be done in future taxes to our children. And so if there's a good pay-for this, I think Mr. Paulson would find that there will be a lot of votes on this side of the aisle. But we have to come up with a way to pay for it. It's painful. I'd love to be able to say, as a member from California, we're going to undo this. And I'm prepared to say that if we come up with a different way to pay for the good services that millions of Americans are now receiving through their health insurance. So with that, I want to, again, compliment those who want to try to find solutions, but let's also find the pay for it. So with that, I'll yield back.